So you've heard me mention cultural relevance a time or two. Let me tell you about a scenario to help demonstrate what cultural relevance is and why it matters for health content marketing. When I was in my final year of pharmacy education, doing my clinical rotations, I had an ambulatory care rotation at Grady Health System, a level 1 trauma center in Atlanta that primarily serves underserved and marginalized communities. I was working that day in the pharmacist-run diabetes clinic, and I was scheduled to see a person who had been newly diagnosed with diabetes and counsel her on what her initial treatment regimen would be. I entered the room and there was a Black woman there, possibly around the age of 50 or 55, and I initiated a conversation with her about her new diagnosis and about her prescribed treatment plan. She looked at me and told me, "I don't know why I'm here. I don't need to see you. I don't have diabetes." I sat there for a moment. The wheels were turning in my head as far as how do I continue this conversation with this person in a way that's productive for both of us. And so I probed deeper into that statement. I said, "Ma'am, why don't you believe that you have diabetes, or can you explain that statement a little more to me?" She explained, that she didn't believe the doctor's diagnosis and that she had always been healthy and didn't think that she had the disease. I asked her, "Did your physician explain to you how he arrived at that diagnosis?" And she said no. So I asked her for permission to show her what went into that physician's diagnosis. So we sat down, I opened up her medical record, and I explained to her what an A1C is, how we use that number, that percentage, to diagnose diabetes, and what her numbers were, what they had been in the past, and how the doctor arrived at that diagnosis. At the end of that conversation, she looked at me and said, "I understand now. Thank you for explaining that to me. Let's talk about my treatment." She explained that she was dismissive of that diagnosis originally because she was honestly just so scared. She had had 2 older sisters, a mother, and a grandmother who all were diagnosed with diabetes, all ended up taking insulin, and all passed away relatively young. She equated a diabetes diagnosis and insulin treatment regimen with death. That was a death sentence for her. And she appreciated the way that I explained her specific condition and what that meant moving forward for her in a way that made it not as frightening and that allowed her to accept the diagnosis for what it was and not for what it had been for her family members. I tell that story to underscore the point that culture matters in healthcare. Whether directly or indirectly, culture is relevant to your patients, and so it has to be relevant for your health company or your health practice. That means it also has to be ingrained into your marketing effort, especially if you have a B2C brand, a customer-facing brand. You have to make sure that those cultural elements that are relevant to your target demographics are embedded into your marketing program. A prospective client or patient can see that, they can sense that in your marketing collateral. And when they see that cultural relevance, it tells them this brand recognizes me, understands me, respects me, and cares about me. And what that does in the person's mind is it builds their brand loyalty and it builds trust. And that loyalty and that trust, that leads to sales, that leads to conversions, that leads to community. So one of the requirements for the clients that we work with is you can't be afraid to have those conversations. You can't be afraid to incorporate culture into your content. And that's what we help you do.